By March, Europe was the epicentre of the coronavirus outbreak, and the Italian town of Bergamo in Lombardy was the epicentre of the epicentre. There weren't enough hospital beds nor ventilators to go round. Medics had to decide who would live and who would die.
It is a disaster, it is a tsunami.
Like hospitals, cemeteries also filled up. There was no time to make headstones, just simple crosses and paper photographs.
The virus arrived and killed as many people as possible, and unfortunately it hasn't gone yet, but it has left us in absolute pain.
Italy was a warning to the rest of Europe, and within weeks neighbouring countries were also plunged into national lockdowns as the virus spread across the continent at alarming speed. That spread was assisted by Europe's demography.
Europe has an elderly population, as does North America. With respect to, for example, Africa, in fact, the relative youth of African populations is considered by scientists to be a factor in why, until recently, they've had a relatively mild epidemic.
By the start of summer, European infection rates and death tolls were dropping significantly, so lockdowns were lifted.
Most scientists think that we didn't get the infection rates down low enough in order to come out of that lockdown when we did. And so basically infection rates grew over the summer, were amplified in September when people went back to work and school and university, and then exploded later that month and in October.
Desperate to save their now flailing economies, European governments encourage businesses to reopen and people to take summer holidays. The movement of tourists saw the virus spread further than it had in the first wave to countries like Greece, which until then had been relatively unscathed.
We allowed this argument to dominate that the economy is more important than public health, when actually they're totally interdependent. And we've seen that in China particularly, where they had a terrible situation in January, but they've come out of it now and their economy has bounced back because they were decisive, they closed down the society, they didn't allow mass events, they were very proactive, and people accepted that.
As many European countries were battling a second wave of the outbreak, Asia appeared to have a better handle on the virus. Scientists say their recent experience with SARS meant Asian governments were better prepared and the population knew the importance of complying.
There is definitely, in at least parts of Asia, a much stronger culture that pre-existed this pandemic of wearing masks to protect other people from your germs. In fact, in Japan, because I wrote this book about the so-called Spanish flu of 1918, in Japan that culture got started after the 1918 pandemic and didn't fade.
But in Europe, people were beginning to question the strategies of their leaders. Track and trace systems failed, infection rates grew, and ever-changing, confusing restrictions on daily life were phased in and out.
The public have to be trusting of the government messages because this is a difficult journey for people. People have to give up some of their freedom for the duration of this pandemic. And that's hard for people. We're not used to that. This generation, the last couple of generations, are not used to hardship.
As a year many would rather forget comes to an end, the outbreak is again spiralling out of control in Europe. Record case numbers and mounting death tolls are being logged in several countries. But the one great hope is the vaccine, and in hospitals like this one behind me, the UK has started its mass vaccination program. The rest of Europe will follow shortly. It will take months to inoculate everybody, but if all goes to plan, COVID-19 will not dominate 2021 the way it has 2020. Sarah Morice, TRT World, London.